Hi, this is Brandon with ChiroUp. I have a patient here today that came in with doing some new activity, and she has some, the typical heel pain that we see all the time with the patients, especially with changing seasons. I see a lot of foot complaints. However, she came in and she's having some pain right at the calcaneus. Hers is a little bit more medial, right off the inside part of the heel. And what I'm finding with these patients is 20% of them actually have a condition called Baxter's Neuritis. And Baxter's Neuritis is when you have some compression of that inferior calcaneal nerve. Now that's a division of the posterior tibial nerve, and it's being compressed right about here. Now the motor division of that nerve supplies the abductor digiti minimi. So a quick, simple test to identify a Baxter's Neuritis as compared to a plantar fasciitis is I'm going to tell this patient, I want you to spread your toes. And when I have her do that, you can see that she cannot spread her toes. She cannot abduct that toe here. And that's a sign of Baxter's Neuritis. Also, I can perform some traction ischemia to that nerve right along the posterior tibial nerve by forcing the forefoot into some dorsiflexion with a little bit of abduction, holding it for 30 to 60 seconds, and seeing if we get reproduction of those symptoms, which can be another sign of Baxter's Neuritis. So this patient I'm going to treat conservatively. I'm going to do a lot of the same stuff we do for any kind of a nerve-related symptom. I can do some nerve flossing for the posterior tibial nerve. That's on ChiroUp. You can learn how to do that. We can also do some myofascial release. We can do some other anti-inflammatory medication, or we can do some orthotic therapy. All those things are very important, but just like any other nerve condition, if we're not seeing any kind of long-term resolution of symptoms, I'm going to consult with a podiatrist or a surgical consult for any kind of neurologic loss.